Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today we're broadcasting live from HIMSS26 in sunny Las Vegas. Very excited to be here, and it's already been an action-packed 36 hours since I landed. This is actually my 12th year in a row broadcasting live from the HIMSS annual conference, and I am more excited than ever. Love this lineup. I'll get to it here in a moment as well. This is actually my 26th HIMSS annual conference, and I cannot imagine missing any of these at this juncture. Hal Wolf and the entire HIMSS team have been extremely supportive, and I'm so grateful. As most of my listeners know, HIMSS is a very special organization overall. And I want to take a moment, a quick note about this annual conference and the HIMSS Society in general. It can be everything that you want it to be. And I say that from the perspective that you'll absolutely get out of HIMSS what you put into it. This goes for relationships in general in life. But whatever you put in, you'll absolutely get out. And that's what I love about HIMSS and what it affords me. And I actually achieved my annual business goals early in the year because of HIMSS annual conference. This specific forum brings together tens of thousands of industry leaders and affords everyone that truly puts the effort in to achieve their goals. It is an 8-week frenzy for me and my team, but we'll host 3 live radio shows, host 3 large dinner events, co-host 4 receptions, and take in a very fun evening at the Sphere on Thursday. And even at this point in my career, and as you know, Roberta, I'm still hustling. It's a lot of personal work and outreach to bring together 300 plus people over 4 days, but absolutely worth it. And a special note here also, HIMSS is powered by its members and chapters. They are the foundation that drives innovation, connection, and impact across healthcare. I highly encourage you, my listeners, to join your local chapter, get involved, and be part of the community shaping the future of health. And I want to also take a special moment here and note a thanks to my producer, Roberta Mullen, my co-producer, Jake Reed, my other producer, Greg Masters, for their support in helping produce these HIMSS broadcasts and recordings. They are always terrific, and I'm truly appreciative of the time they invest to make this show a success. For this specific broadcast series, though, I have a fantastic lineup of CEOs, CIOs, care providers, innovators, policy leaders, and visionaries. Here's a glimpse. Hal Wolf, President and CEO of HIMSS, Anish Chopra, we all know Anish, Rasu Shrestha from Advocate, Marianne Yeager, CEO of Sequoia Project, Dr. Erica Kim from ARPA, Simon Philip Roast from GE, Nelson Gomes from Medicus IT, Charles Barkey from West Virginia Medicine Hospitals, Richard Atkins, CEO of Greenway Health, Matthew Unangst from AMD, Leah Gabbert from Nutanix, and John Henderson from Rady Children's Health. And I have a couple other special guests joining here that will be broadcasting later. But as many of you know, you've been listening to the show for years. My goal is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. My goal, along with all my guests here, will be to offer tactics and strategies to not only survive, but thrive as you navigate your hospital, your physician practice, your company, or even your family through all these changes occurring across healthcare today. There is more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practice and innovation can support our efforts. I hope you glean all of that over the next few days. That's at least my goal. Welcome back to This Just In Radio Show, broadcasting live from HIMSS26 in sunny Las Vegas. Very excited to introduce my next guest and new friend of the show, John Henderson, Vice President, Chief Information and Digital Officer from Rady Children's Health. Welcome to the show, my friend.
My pleasure to be here.
Excellent to have you. So your name came up in several different organization meetings, and so we had to have you on air. A lot of great thought leadership. We know you're doing a lot of great things at Rady. Before we dive into the questions, tell us a bit about Rady Children's Health, because it's a newer conglomerate in a way. So talk about that a little bit.
Right. So just over a year ago, January 25, Rady Children's Hospital San Diego merged with Children's Hospital of Orange County in Southern California to combine what we now call Rady Children's Health. 3 inpatient hospital system, approximately 100 primary care locations, subspecialties, all of the different things that you would expect from a large pediatric health system. And so we're just over a year into that merger. Have a tremendous amount of integrations, unifying platforms,
Absolutely.
EHRs, ERPs, all of the things, bringing 2 cultures together, 2 wonderful organizations to really drive pediatric health care in Southern California and beyond.
Love it. So I have a near and dear to my heart is children's health, not only from a public policy standpoint, but also Donna Hyland, the president and CEO of Children's Healthcare of Atlanta, CHOA. And so Donna, we served on a board together 20 years ago, became fast friends. And I love what she does for our community, but also a little bit on the national side, but certainly for the Southeast, CHOA is fantastic. So I have a soft spot for children's healthcare. So I love it. Congrats. How long have you been with Rady's?
9 years last month.
Okay.
Yes. It's time's flown by.
And where'd you come from?
Originally from Houston, Texas. I was at Texas Children's Hospital there for many, many, many years, and moved out to Southern California to lead Children's Hospital Orange County, and now Rady Children's Health.
Love it. So you have a unique perspective in the industry. Where do you think leaders must get right now? A lot of moving parts in healthcare and digital health and certainly AI, but what are some of the things that leaders must be ready to navigate now and be ready for?
I think right now, and this is going to sound like table stakes, but it's really important in healthcare. I think right now we have to really be focused on shrinking the initiatives that we're asking our organization to run at the same time.
Okay.
And the reason I say that is lots of headwinds in healthcare, particularly pediatrics, from federal regulations, the market, pressures to drive cost out. And if we don't strategically look at what we're asking our organization to do and shrink that, focus on doing the right things really, really well.
Right.
That's where I think we have to really focus, not just from a Rady Children's Health perspective, but just healthcare in general. For me, if you talk to really any CIO in the business, they're going to tell you their portfolio and the appetite in healthcare systems to do many, many things at once is pretty insatiable. And I think that's not a sustainable model for the types of headwinds we're facing right now.
That's a great perspective, and I have not heard that yet. So again, I knew your perspective would be unique, and I totally agree with that. I love it. Where are you seeing, from maybe obviously your organization, but also wherever, where are you seeing tangible ROI from digital health or maybe AI, again, in your organization, beyond pilots, but really at scale?
I think probably there's really a couple of areas. So our Patient Access Center, we centralize that, focus on improving access. Decentralized before, not really able to manage and understand our metrics, how we're performing. So we implemented a call center platform that allowed us to really get to best practice for a patient access call center. In addition, adding the virtual agents into the mix, allowing us to take more calls, not increasing the number of agents, taking those calls, but leveraging that technology. Real tangible benefits with our performance. I think the other area, ambient, we've deployed ambient to a couple of hundred physicians, and our focus is not on getting our physicians to see more patients. It's really about the quality of the engagement and giving them quality time with our patients, but also reducing the amount of time they're spending after hours. They're called pajama time.
Right.
So we're seeing real benefits there. It varies by specialty because different specialties have a different documentation experience, but we're seeing tangible benefits in reducing the after hours documentation time and just a better experience with the EHR because they're more focused on the patient and that experience.
Yep, love that. We want to be uncomfortably close. There we go. Perfect. Right. Before I go to the next question, what do you hope to achieve here? First of all, what are some of your goals for HIMSS26? But then also, what do you hope to achieve over here?
Primary goals for this conference is really meeting with some of my key technology partners face-to-face. We do a lot of virtual, but really spending some time focused on things that we have to do for this merger. Yep. We have a big Microsoft work stream right now to integrate those platforms. So spending time there, spending time with Epic. We're unifying our EHRs on that platform, so spending some more time with them. And really trying to understand what other vendors here are doing some interesting things with AI that maybe I haven't heard of before, and seeing how that may fit into the portfolio that we're looking for.
Do you have a speaking engagement here? Did I see you on the stage here?
I am tomorrow at 11 with the AWS panel. I'm talking about data in our platform and how we're approaching that and what it means for our health system and for research and how we deliver care.
Excellent. Yeah, I remember seeing that. So that's why I wanted to make sure we got you on air for sure. So I guess following up a little bit in this direction, I love this question. It is a hard one, but now I'm starting to see a theme, and I'm sure you'll hit this theme as well. How do we keep healthcare human in an AI world?
I love this question.
Yeah.
I think we keep it human by not falling into the trap that AI is going to replace all human activity and the workforce.
Yeah.
I think it's a tool to augment and to elevate how our workforce performs the necessary roles that we need them to perform. I think if you look at it from I like movies, so I'm going to throw in Minority Report, Aging Myself, and iRobot.
Yep.
Those movies were really, particularly Minority Report, it was kind of a precursor to everything we're seeing now. And even though it's a movie, I think it teaches us a valuable lesson. Machines are important. Technology is super important for enablement. But we can't allow technology to be the end-all story. Humans create it because they have expertise. And I think we have to keep that at the forefront of what we're doing when we're enabling AI. It is a complement, it is a tool, and we need to continue to leverage the expertise because they're not perfect.
Right.
Math is rarely wrong.
Right.
And so it's never going to be perfect. It's always learning and evolving. And as long as you think about it in that context, you need that human judgment and decision making in the process.
So we have an extra second before we dive into the last question, and I love that perspective on how to keep healthcare human in an AI world. What is your talk specifically be on tomorrow, and what are some of the key points that you're going to talk about from stage tomorrow here at HIMSS26?
So tomorrow we'll be focused on thinking about data platforms in a different manner than what we would typically see in healthcare, but also how do you focus that on serving the various audiences? So there's the research component, there is hospital operations, there is the hospital data science, and how do you leverage those human beings with that tremendous amount of capacity and talent to really improve care at the bedside and integrate it at the point of care. So really talking about how that platform can help serve all of those audiences, because historically data platforms are solely focused on hospital operations.
Right.
But for my health system, we need to serve all three of those really well.
Yep. Love it. What is there a best practice in there, or say? I know it's a big topic, but what's a best practice? Because my show is heavily focused on best practices and key strategies to thrive or successfully navigate the future of healthcare. From that perspective and that lens, what would you say a way for someone to address that or engage that successfully? Is there a best practice there?
I think really I would say the key best practice is your architecture is super important, but beyond that, it's really the data governance and the engagement with clinicians and operations, because if you don't understand what they have to answer and what their needs are, then you're going to build something that no one is going to come to.
Fantastic. And Jake's probably smiling. I've been pulling governance out of everybody. It's not a sexy topic, but it's so critically important at in a multitude of levels. So as we move to the last question here, what must we get right over the next 3 years in healthcare?
So I think two fundamental things. I think continuing to invest in our people and upskilling.
Excellent.
Because the technology is evolving. Yes. I think the second thing, particularly as it relates to technologies, is scalable, resilient architecture. If you don't have it, you have to move towards it.
Yes.
The health systems are going to need you to be flexible, and you're going to get things coming your way, whether it's regulatory, whether it's the market is shifting, and if you don't have the right platforms to address the business needs and the clinical needs that are coming, then you're not going to be able to serve that health system effectively to help drive them forward.
That's fantastic. I do want to kind of take a step back to your point, because you're only the second guest today to bring up kind of the upscaling and adding to education and really understand, those kind of investments in your people and upscaling your people. And I mentioned previously, I just graduated Stanford last year, and this degree and class that I took was all about upscaling your employees and the importance of understanding truly what AI is about at the fundamental level, not just what are the strategy and how can I deploy it or whatever, but what's the architecture, the fundamental around digital health, healthcare in general,
general, and then AI and all of the foundations and layers underneath it. So when you do make a decision and AI and your team around you can understand what you're talking about, everybody's kind of growing together and educating themselves together. So you're the only second guest to bring it up. I didn't even bring it up in any of my talks, so I'm glad that you did, because it's really important, upskilling your knowledge and learning the fundamentals and the foundations.
Right. No, completely agree. I think if you think about EHRs, traditionally your teams are focused on how do I traditionally support an application. I know the mods, I understand how it functions, I know workflows, but they're not thinking about do I need to understand these tools?
Yes.
And how can those tools help me do my job better? And not only focus on how can I enable them for the clinicians, for our patients, you also have to think about for yourself.
Absolutely. John Henderson, thank you so much. Truly appreciate you joining us today. Thank you.